Good afternoon, everyone. Thank you for inviting me here to tell my story. If you asked me a few months ago if I'd be here talking to you about what I experienced, quite frankly, I would tell you no. That's how fast my health deteriorated, leaving me to question whether COVID would be my final days. I would not be able to watch my college-age kids achieve their next life milestones. I would not be there for my wife, who has been my champion throughout this entire epidemic. I would not be working at my church where I serve as a minister, and I certainly would not be able to help anyone dealing with this deadly virus. That's how serious my illness was. While I am now healthy and moving forward, I'm still frightened watching other states across the U.S. experience what we did just a few weeks ago. As a regional director for Northwell's Center for Emergency Medical Services, I thought I had seen it all. 9/11, Ebola virus, Superstorm Sandy, bird flu, and so on. Some are even equating this to what was seen with the AIDS epidemic of the 1980s. But I can honestly tell you, COVID-19 is something like we have never experienced. As highly contagious as this virus is, we still geared up and did what we as EMS professionals do. We have immense pride in our work and carry strong bonds between us. We took this battle beyond the front lines and into the homes of the affected. If hospital workers are the front line, we in EMS are the special forces that venture behind enemy lines into uncontrolled environments to retrieve and rescue the sick. So, when the patient surge hit New York, specifically in Queens, New York, I turned in my business suit, put on my uniform, and went out onto the front lines to help. People were scared then, and they are still scared today. As a leader, I could not ask my staff to enter into a situation that I wasn't willing to enter myself. A few months ago, we were forced to learn about COVID-19 in real time, quickly trying to determine how people get it and how they can stop its spread. In reality, all we really knew was that this was suffocating people at very large clips. There were times when our protocols were literally changing by the hour. Northwell then was utilizing its expansive network of hospitals to triage patients to balance the load and help reduce the stress on the emergency departments. There were a lot of sick patients, most of which needed to be ventilated. One of Northwell's hospitals in Queens was in the epicenter of the pandemic. A big part of what we were doing was transporting patients out of that hospital to others within the health system, load balancing. At its height, we transported 75 to 100 patients each day. At that time, when COVID was at its peak in New York, the amount of emergency calls was doubled. We began to see burnout from our staff due to the high number of cardiac arrest responses that they were doing. I'll never forget the night I contracted COVID-19. It was Monday, March 23rd. I decided to work an overnight shift, and we transported numerous patients that night. By that Thursday, I started feeling symptoms. Nothing serious at first, but enough to make me concerned. I immediately self-quarantined in my basement. The next week, I tested positive for COVID. Now, I do consider myself fairly healthy. I run several miles each week, and as I mentioned earlier, I'm very active in my church. But this was a health scare like I had never had before. I wound up having every possible symptom. It started as a cough, then progressed to fever, chills, body aches, loss of my sense of taste, no appetite, nausea, severe fatigue, and shortness of breath. My wife drove hours looking for Tylenol. She was finally able to find some in New York City. I went to the hospital twice. After the first visit, I was diagnosed with double pneumonia due to COVID-19 and was released. Despite being released, I was extremely frightened that night. I couldn't breathe and my oxygen level was 82%, well below the norm. Being a paramedic, I was scared of going into respiratory failure and needing to be intubated. And my struggles continued throughout the night. Too weak to turn on the lights, I spent most of the time in darkness. My EMS team left some oxygen with me, and I ended up going through 7 oxygen tanks that night. I wasn't sure if I'd make it through the night, and I refused to go to sleep. Earlier that evening, I sent a text to my pastor and some of my clergy friends saying, and I do quote, "This virus is trying to kill me. This is the scariest thing I've ever dealt with. I have zero energy. Please pray for me." My wife was nervous. My boys were scared. I kept thinking no one or family should ever experience this. The next day, I was admitted to North Shore University Hospital, which is Northwell's flagship hospital in Manhasset on Long Island. I can honestly say I received the finest care while at North Shore. Ultimately, I was there for 5 days and participated in a clinical trial. I was also treated with prednisone, oxygen, albuterol, and several other medications. During my stay, a few of my friends and colleagues passed away, but my wife refused to tell me while I was in the hospital. She couldn't visit me, and I was too weak to use my phone. We had very little communication. Breathing continued to be my main issue, but the team would not let me give up, and it did improve. I was discharged on Easter morning, which was a day earlier than expected. Being home on Easter was definitely a blessing. I got to watch a streaming service at my church before heading back down to the basement. Being isolated down there helped me realize and allowed me to reflect. I needed to be re-energized, not only to be there for my family, but also for my EMS brothers and sisters. It was a slow process, but I was able to return. I returned to work on Tuesday, April 21st, just 1 month after testing positive. At first, my energy levels would run down toward the middle of each day. This is one of the lingering effects of the virus. When people say they have recovered, they just mean that they haven't had symptoms in a while. But there are health issues beyond COVID-19. Some are still reeling after weeks, even months of battling this virus. This is very serious. I slowly integrated myself back to work, and I'm feeling pretty good today. I am still in uniform and will remain so until the all clear is given. This battle against COVID-19 is exactly that, a battle. We are at war. A war cannot be won without great leadership. I am grateful for the leaders that have taken charge in this war and honored to serve side by side with them. I consider myself blessed to have my family and strong ties at Northwell. Without them, you would definitely be hearing about someone else's experience today. Overall, I'm very proud of our staff at the Center for Emergency Medical Services who have helped thousands of people throughout this crisis and risk exposure with every call. They are among the many heroes of this situation, and I'm honored to be back working alongside each and every one of them. I would like to thank all of the leaders and innovators in attendance today for being agents of change. Your collaborations and partnerships will elevate the field of health innovation tremendously. And finally, thank you for letting me share my story.